All right, I'm back with you again. This portion of our talk is going to evolve around why are we interested in telling you all of these things about diabetes. Diabetes is not going to do anything in itself in all probability to you, but it's the accompaniment that goes with the diabetes and the metabolic syndrome that we worry about. The other organs that can disable and kill you. The first is your heart. The cardiac complications of diabetes result from two things that we see, or maybe even three. The effect on the lipids that evolve from the metabolic syndrome, in which cholesterol and triglycerides, we'll talk about them later too, but are elevated, and these all contribute to hardening of the arteries, of the lining of the main arteries, particularly the small ones that go into the neck, the head, and the heart, the kidneys, and other organs of the body. And as these accumulations of cholesterol deposits occur in these vessels, the amount of blood that the vessel can accommodate reduces until the point that at one point or other the thing closes up altogether and you have an occlusion of the artery. Well, certain organs and certain parts of organs are very, very dependent upon this supply of blood. The brain, for example, you will have a stroke. And if it's a major portion of your brain, it is unsustainable by life, and it will eventually kill you. If it is your heart that's involved in this, there's only the one blood supply to the heart that comes from the coronary arteries, and if it gets cleaned off and all the branches of it are obstructed, then the heart will stop beating and you no longer will be able to sustain life from it. Down in the renal area or the kidneys, we have the same sort of situation. We do have two kidneys. We can get by with just one, but if they start becoming involved, then the length of life is subtracted, and high blood pressure also contributes to both the heart problems and the kidney problems and the brain problems that we see that will eventually cause disability. There are involvements of the nervous system. However, also in this sort of thing, we call these neuropathies that accompany diabetes, and we feel that it probably has something to do with the circulatory effects on these vessels, on these items too, the peripheral nerves, that has its effect. Very less common we see of the digestive system, in which circulation to the bowel is reduced, and you can have abdominal and intestinal complications of infarctions or loss of blood supply and death of the organ in the intestines also. So all of these things are the eventual products of damage that comes along with diabetes and the metabolic syndrome. You can have these things without diabetes, of course, because all of these are contributors, and rarely do they involve just one of the contributors to it, so that we have both the circulatory things that are involved with the blood vessels and the atherosclerosis, or the hardening of the arteries that goes with it. And then we have the effect of pressure itself on enlarging the heart and making it starting to fail, or resulting in the damage to the kidneys from the pressure being high. So all of these are the items that are involved in the whole picture, and all of them need to be treated simultaneously. Now, they are not all present in equal abundance. For example, some people will be have mainly high blood pressure, and some diabetes, and some of the arrhythmic problems of the heart, and others will have more hardening of the arteries and less blood pressure trouble, and so the disability can be seemingly a one system only, those having a stroke, and that's more related to high blood pressure than it is to other items. As we have become better over the past several years now in treating the blood pressure problems, we see much less of that as a complication of the whole problem. In order to make the diagnosis of diabetes, we need to be able to test the blood to see if sugar is higher or lower than it should be. And this has been always the problem that we had in years past, is we had no way of doing this. You had to go to the laboratory or to the doctor's office to get your blood tested to find out was your blood too high. And it's only been in the last few years that we've had the finger stick blood sugar testing that can be done by the individual at home. Before that, we used to check the urine, because the urine, the sugar does get out of our body by flowing into the urine when the sugar is going out into the kidneys at too high a rate and is not reabsorbed back into the body. So there are two measurements that one can make then on this sort of thing. But again, this just tells us what the blood sugar level is. It doesn't really tell us if you have inherited insulin that doesn't work, because you may be making 3 times as much as should be in order to have, if it's only working at a third of its potential, in order to have enough to bring your sugar down. But if it brought your sugar down, you still have this inefficient insulin going on with you, but your sugar's okay. So we can't make the diagnosis of diabetes in this sort of a case. It's only after you've had the disease for some time, and eventually you fall way behind on how much you can make to make up that difference, that your sugar starts going up, and now we can make the diagnosis. And that's why the type 2 diabetes was often called adult onset diabetes, because you didn't, while you were a kid, you had it, but you made so much insulin that nobody knew it. And it was not until you started running out that you started becoming evident that that's what you had. So we have to measure it. Well, this is strictly a chemical process of finding sugar and reducing it, and developing a color method of determining how much of that carbohydrate was sugar. We can use carbohydrate that is not sugar, but sugar is the main one, and oftentimes it has to be converted from starch that we digest in our body in food that is not sweet, for example, but our digestive system will turn that starch into sugar, and then the sugar can be then converted into energy by the insulin.